Thank you for choosing to see me at the Center for Facial Plastic and Laser Surgery. As you can see, our practice is located in the Forum at Ballantyne Commons. The address is 11220 Elm Lane. It's located at the intersection of Elm Lane and Ballantyne Commons. Purposely, I chose this location because of the ease of access for my patients off of 485. I have many patients that come from within the city and from outside the city and even from the surrounding states. So having a location off of 485 was key to my practice being accessible for everybody. As you may guess, we do a lot of surgery here at the Center for Facial Plastic and Laser Surgery in our private OR suite. For the convenience of our operative patients, I have a private parking spot that you will find located in front of the building. This is here for patients to use the day of surgery, so they do not have to hunt for a place to park. My staff will then have you come through the back door in our back entrance to the OR suite, which is also used after surgery. So the day after, when you come back and you have to have my staff and myself check you, this spot is also reserved for you. My staff will get you in a wheelchair, and again, you can come through the back door entrance so you don't have to go through the lobby. And after we come through the front doors, we walk to the end of this nice lobby. You will find that my office is at the end of the lobby, and we make a sharp left and we go down to Suite 101. So why don't you follow me there? Once you've come down the hall a short distance, you'll see this entranceway here. You'll know you're in the right place when you see my signage on the wall. And once you're here, just come on through the front door and let's go see the practice. Welcome to our waiting room. This is where you'll check in with our receptionist. When I started my training, I knew I did not want to be a jack of all trades and a master of none. So for that reason, I chose to specialize in facial plastic surgery only and have done so since 1988. I think that specialization is reflected in all the procedures that we offer, from facial implants to brow lifts, which we tailor-make to the patient, to the lower lid procedure I do called the SUF lift, and in particular with rhinoplasty, where you need somebody who specializes and has gray hair. Hello again. I'm going to take you into our consult room to meet one of my patients and have you a little foreshadowing what you can expect when you come to see me. So let's just get the chart and go on in. Hello, Cheryl.
Hi.
I'm Dr. Freeman.
Nice to meet you.
Very nice to meet you. Let me just take a little look at your history here. Looks like you're a very healthy young lady, which makes my job a little easier. Cheryl, I want you to look in the mirror there and show me what you see when you look in photos and you're getting your makeup on. You say to yourself, I need to go see Dr. Freeman. What is it you're seeing?
My eyelids are hooded.
Okay. Well, let's talk about that. Hello again. Now we're going to go into our post-op room. We have a patient waiting for us there, and we're going to see how she's doing. Come on with me.
Hey, Dr. Freeman.
Hello, Herb. Hi, Debbie. You look like you're doing great. Is everything going well?
Yes, thank you.
Fantastic, fantastic. I'm just going to take a look at your incisions and see how they're healing. So I'll just have you turn your head a little bit. Hello, Shirley. Good to see you again.
Thank you.
I'm looking forward to talking about your future surgery. We're going to be talking about your lower lids, but before I get to that, I just wanted to show you where we're going to take your photos. We have all of our patients sit here with this blue background. It keeps everything standardized for the pre and post-op photos so you can see exactly how much improvement you've had. We also use this setup for our computer imaging, which really doesn't help much for the SUF lift, but for other procedures it comes in handy. Before we get to that, I want to sit down at my desk and show you some information. Well, what I like to do at this point of the conversation is go through some slides with you. I use the PowerPoint presentations a lot because a lot of the procedures that I do back in the operating room are also procedures that I teach at our academy. So this is actually from a PowerPoint talk that I give to physicians about once a year, but I'll make sure it's in plain English so everybody understands it. So this is about the SUF lift, and this is something I've invented, so it's made me fairly well known, taking me around the country and even to Barcelona and other places in Europe teaching doctors how to do this procedure. The typical patient that we see is somebody that presents with puffiness here, hollowness there, and the question is, of course, how do you fix that? This procedure, I think, is a major advancement in fixing this problem in a very natural way. As we go on, I'd like to show you now where the surgical coordinator sits. And after I finish answering all your questions and going over all the slides and making sure that you don't have any other problems or questions concerning your upcoming surgery, we go and talk to our surgical coordinator. Now, she is in charge of doing things like trying to find you a good operative date, going over when we operate, answering other questions, going over financial options with you. And also, once you're done with her, if you have any other questions, she'll bring me back into the equation. So let me interrupt them for a second just so you can see where that is done. Hello, sorry for interrupting. I just wanted to show our audience that's following me around today where the surgical coordinator sits, and that's basically all we're doing. So I'll let you get back at it.
All right.
Thank you
great.
very much.
Thank you.
Hello again. So you've made the decision to get your surgery done, and I think you're going to be very glad that you did. Well, what happens next? Well, once you've scheduled your procedure with my office coordinator and gotten all those arrangements done, my nurse takes over. She will spend about an hour with you before your surgery, making sure you got all of your questions answered about what to do before and after your surgery. So I'm going to introduce you to one of my nurses. She's busy doing a interview right now, so we'll just interrupt her for 1 second. Come on with me. Hi, I'm sorry to interrupt. I just wanted the audience that's following me around to see where the nurse works. So I'll let you get back to your preoperative teaching, and I'll see you later.
All right. Thank you.
You're welcome. Now I just want to take a minute of your time to show you where our laser procedures are done. This won't take much time at all. I use actually 4 different lasers routinely in my practice. This laser here is known as a Q-switch Didymyag. It's the state-of-the-art laser for tattoo removal, and I also use it for removing brown spots, like those little brown spots we get on our hands and face from the sun, and for treating a condition known as nevus de ota. This laser here is known as a variable pulse dye. This laser is the best laser on the market for treating spider veins. I also use it for children and adults that have a condition known as Sturge-Weber or port-wine stains. This laser is called the smooth beam. It's a great laser for treating juvenile cystic acne, sebaceous gland hypertrophy, and it also has a role in non-ablative resurfacing. The other laser that I use routinely is a CO2 laser, but that's done in my operating room, not in the laser room. Now, I know the operating room can be a bit scary for some patients, but I'm very proud of the facility that we have here, and think that if you look at it in that light, you'll find that it's a good thing that we have such a spacious, modern facility. After you change your clothes in here and get your surgical gown on, we bring you through this door and over to the operating room bed, which is situated here. This tower is used to do all our endoscopic procedures, which emphasizes the minimal incision approach, which makes your healing go faster and all the advantages of that. We do use typically a general anesthetic, and in the operating room you'll have myself as well as a certified anesthetist with over 20 years experience. You'll have Herb, my surgical technician, as well as an RN. So you'll have 4 people watching you at all times during your surgery. Once your surgery is over, we go into our recovery room, which is through this door right over here. When you're in the recovery room, you will be watched by my nurse for until you are what we call awake and alert, Norton times 3. So it's all one-on-one care here. You are our focus of attention, which is something unique to our facility. Thank you all for visiting us on this virtual reality tour of our office, and I look forward to taking care of you soon and seeing you here at the Center for Facial Plastic Surgery.